Hello there, I'm Doreen Gensler. I anchor the 6 and 11 o'clock news weeknights on NBC Washington, and I am a big fan of the work that Hope Connections does. It's my pleasure today to introduce two people that I think many of you already know. Dr. John Marshall is the Chief of Hematology and Oncology at Georgetown University Hospital. He is an internationally recognized expert in new drug development for gastrointestinal cancer. And Liza Marshall is a retired attorney and a very active community volunteer. She helped found Hope Connections for cancer support. And a little known fact, she was also a Jeopardy champion in 1997. And these two are married and they have written a new book that we're going to talk about. I just want to start by asking you, you've been through so much, and why did you want to relive all of that and write this book?
So the answer is, at first we didn't want to relive it, but we really felt that our story was unique, partly just because John is an oncologist, but also because John is an oncologist who is voluble about his envy of the breast cancer machine and how much advocacy and research funding breast cancer gets. And so the fact that I then was diagnosed with breast cancer, John viewed as global vengeance or something. But it did make for both of us a unique and an interesting journey, I would say, coming to terms with my diagnosis and the fact that the research funding that had been accumulated and used by breast cancer researchers really probably did lead to my cure.
Before our experience with cancer, I really thought I was a great doctor. I thought I knew everything. And then going through this, having converted now to a caregiver, a consumer of what we do, I realized there was so much I didn't get, I didn't understand. And so from then on, it was like every patient I saw, every couple I was seeing, I wanted to tell them, I know what it feels like over there. And that to try and be more empathetic, to try and understand and help guide them even better. And so then it's sort of like, well, we should tell this story kind of more officially in a way that it may reach others. Honestly, in some ways, writing this was our first chance to tell each other some of the things that we felt. And time may have been important in that. I mean, I think if we had done it right after or during, it could have been a threat to our relationship or just how we felt about the whole thing. So given that time had passed and we cooled off and we felt more comfortable about where we were with your cancer and life in general, that we could begin to share those things.
What kind of support were you looking for besides the support that was right in your house?
Right.
Besides clinical care.
So it was a strange situation for me having, I was very lucky in that I had an oncologist around all the time, but I also knew that he knew a lot of things I didn't want to know. And so I think, it is important when you're going through cancer really to find that group of people that have been through it before and who can understand what you're going through.
Cancer is a team sport medically. We recognize that you need surgeons and oncologists and radiation oncologists and social workers and nurses and all of that. But that's to take care of your body. What we don't really spend very much time on at all down there at the hospital is your heart and your soul. And it's just so important to also manage that piece of it. And so, for us, this Hope Connections and other institutions like that bring so much to the table that patients need and want. Your life's going along and then wham, out of nowhere you get a cancer diagnosis. It could also be thought of as somebody pushes you out of a plane and you just can't feel the earth. You're just falling and you're not hearing anything and you're not understanding. And it takes a while for you to feel the ground underneath you. And I think Hope Connections helps be your parachute, helps catch you so that when you land a bit softer and then you can proceed on. So it's so important to kind of reestablish normal, and the kinds of things that Hope Connection does allows you to do that softer and safer.
As John says, your heart and soul are the part that don't get treated, and to be able to address those things, I think, is really crucial to cancer patients and their ability to deal with what they're going through and to get better and go back out into the world again after a day of treatment, and to be able to cope with the things that we all have to deal with on a daily basis, which can be frustrating and irritating, never mind when you're feeling debilitated and also frustrated and irritated and angry, perhaps, about what is going on with you.
What are some of the important ways that organizations like Hope Connections or other organizations, what are some of the important ways that they can help the patient and the caregiver?
Hope Connections to me is such an important organization, and one I've been involved with, as I say, from maybe not quite day one, but day about 30 or 60. So, and of course, what we're doing here tonight is raising money to support this organization. And the reason that I have been involved with it for so long is that the work it does and the reach it is developing around the Washington region to support cancer patients, to support caregivers, to support families, is something that I don't think is offered a lot of other places. It is not that easy to find. It is not generally available in a hospital or a medical office setting. So the opportunity for people to come to a place like this where they don't have to pay a dime for anything.
Who should read this book and why?
It's a how-to guide written without do this and do that. It's a how-to guide of this is our experience. Here are a lot of things we learned from that experience, and take that as you will as it applies to your own. But I do think we certainly do hope that doctors, that caregivers, and when I say caregivers, I don't just mean a cancer patient specific caregiver, but the whole group of people, the team, all of these people, that social workers will read it, that nurses will read it. And then I think we all, doctors in training. And then, we also just hope that the story itself is interesting enough that even everybody I think has been touched by cancer. I honestly don't know anybody who hasn't. So I think there are a lot of people that we hope just will find reading about it and learning about somebody else's journey and the lessons we learned from it will be useful and interesting.
We were trying to just tell a story of what it was like from all the different vantage points and the effect that just one event, in this case it was breast cancer, could have been any disease, could have been any event in some ways, how it sort of affects all the people involved and the perspectives that were involved. And if people take away from that some lesson that makes their world a little better, then we've done a good job.